She's prepared to talk.
Thank you so much for coming back to Soda City Live, joining us. Every Wednesday here on Soda City Live, you're going to raise awareness about breast cancer, as October is Breast Cancer Awareness Month. And today, kicking off our segments for Be Well Wednesday, discussing breast health and high-risk breast cancer patients, we have someone that is on the opposite side of that. Dr. Jennifer Gnerlich of Lexington Surgery at Lexington Medical Center, here to give us some basic information about breast cancer and more of what she does when it comes to dealing with patients who have just received that news of a diagnosis. Thank you so much for joining us today.
Absolutely, thank you.
Yeah, really appreciate it. So I'll start with the first question, just so everyone understands what you do. As a surgical oncologist, after someone has been diagnosed with breast cancer and they have to come to you, what are some of the discussions that you have with that patient?
Yeah, we have a lot of discussions. We have their family history, which is really important to see their risk factors for breast cancer. Then we kind of talk about how we're going to stage the breast cancer, where it's gone to possibly other parts of the body, and then how we're going to treat it, whether it's surgery, chemotherapy, radiation therapy, or other types of drugs. And then after that, we kind of talk about how it's going to feel when you have a breast cancer diagnosis and what survivorship is like. And that's what we're excited to talk about, is survivorship.
Yeah, you have such an important role, because not only are you giving that medical advice, I only imagine that you have to be somewhat like a counselor and console that person too. That's a lot of heavy news. For someone who may have just received a breast cancer diagnosis, what would be your advice to them when they're trying to take in that they have just been diagnosed?
I think the biggest thing I always say is feel your feelings. You know, be able to sort through them, talk about it with your provider, talk about it with loved ones. And also, you know, get ready for a new baseline of normal. I think people have an expectation that once this is all over, they'll go back to the way they were. I think that sometimes you're a little changed by your experience, hopefully for the better during this journey. And that's, again, where we talk kind of about survivorship, but there's going to be a new baseline of normal.
Yeah, let's talk about survivorship and some of the factors that put women at high risk for breast cancer, because oftentimes we do hear from those who are battling it, but then you have women who may not be experiencing that yet, or they just don't know what to look out for. They just know October, we're pink, but what exactly am I looking out for? So explain some of those factors to us.
Yeah, absolutely. Well, I think to answer that question well, we have to realize what's our baseline risk of, just as being a woman, what's our baseline risk of developing breast cancer? And that's 12.5%, just being a woman. And then if we want to figure out if someone's at increased risk, we start delving into a little bit more questions. What's their family history and what's their personal breast history? So family history, I start asking about, are there any first-degree relatives, like parents or siblings, like a sister who has breast cancer, especially before the age of 50? Any males in the family that have breast cancer, or anyone that has ovarian cancer. And the questions are pointed towards looking for specific genetic mutations. And these are BRCA1 and 2 genetic mutation, which we know gives the highest risk of breast cancer. And these have kind of come into pop culture because of Angelina Jolie and Christina Applegate being so vocal about their choices with BRCA1.
Absolutely, and that's why they had both of their breasts removed because of that.
Yep, absolutely. So it's so great that people are becoming more familiar with that language. It's easier to talk to them in clinic. I also ask if they have an Ashkenazi Jewish heritage. That puts them at increased risk of doing, or of getting, the BRCA1 or 2 mutation passed on to them. And then we run the family tree and we look to see if they have a 20% more lifetime risk of getting breast cancer. Remember, that first baseline was a 12.5% risk. So if we look at the family tree and it's over 20%, then that brings other options on the table, like increased screening.
Wow. And so I know that at one point some people believe that you had to be a certain age to go and get a mammogram. Is that true, or is that not true?
So great question. We really like to not bring mammograms on the table till at least after the age of 30, just because the breasts in young women are so dense and less fatty. It's hard for mammograms to be very accurate. So we try to wait till the age of 40, which is when the screening guidelines exist to start your annual mammogram.
All righty, that makes a lot of sense. Thank you for explaining that. And what should you do if you are found to be at an increased risk for breast cancer? So you got that news, you know that you are. do you call and make the appointment yourself? Like, how does that work?
Yeah, so if you do, you should definitely call to have a breast surgical provider, whether it's a surgical oncologist or a breast surgeon, see you, and they're going to refer you to a genetics counselor. That's the first step. The second is then we talk about increased screening, and then what that means is usually our women are told to get an annual mammogram every 366 days to keep up with their screening. But if you have increased risk, we're going to alternate between mammograms and MRIs every 6 months.
Okay.
So that's the increased surveillance. The third way to reduce your risk would be to go on a medicine that modulates or kind of changes the estrogen receptor, and that decreases your short-term risk. And then the most aggressive way to kind of reduce your risk of breast cancer, especially if you have the BRCA1 or 2 genetic mutation, just like Angelina Jolie, is to consider a risk-reducing or prophylactic mastectomy where both breasts comes off.
Yeah.
But I have to say, I want people to be aware that if you choose that route, it only decreases your breast, I shouldn't say only, but it decreases your breast cancer risk 90 to 95%. It's not 100%.
Really?
Yes, and I think that's really important for people to know.
I did not know that.
Yes, yep. And that's just because the breasts kind of go up to our collarbone and kind of down into our armpits, so being able to get out all of the breast tissue is a little impossible. So it's not 100% reduction. It's not if I take off both breasts, I'm never going to get breast cancer. That's not true. But it is up to a 95% reduction.
Thank you for setting the facts straight about that. I thought that's how it worked, so I'm learning something here as well, so thank you so much. What are some of the important things that people can do when it comes to making sure that they lower their risk for breast cancer? Obviously, we just talked about the anti-inflammatory diets. I imagine that what you eat is important.
It absolutely is. So maintaining a healthy body weight, that's hard right now in our kind of epidemic of obesity, but it's really important to maintain a healthy body weight, and that's because the fat that's kind of under your skin converts chemicals into estrogen. So the heavier you are, the more your chance of breast cancer increases, which is why we want people on a healthy diet and to be at a normal weight.
How do you know what is the normal weight?
Yes, so I get asked this all the time. There are calculators online, and they put in your height and your weight. And then they calculate something called a BMI or body mass index, and you should be below 25 to be a healthy body weight. Somewhere between 20 and 25 is probably the absolute goal.
Nice. Okay. Any final tips that you would like to share with our viewers today about making sure that you decrease the risk for breast cancer?
Yeah, I would say also American Cancer Society strongly recommends exercise. This kind of also goes into a healthy body weight, but 30 minutes of exercise 5 times a week, so 150 minutes. No smoking, no tobacco smoking, no vaping, and limiting alcoholic drinks. This is always not a popular one, but limiting alcoholic drinks to about 2 drinks a week. It helps reduce your risk for breast cancer.
Listen, it may be the smallest tweaks. It may not sound like something you can do, but if it's something that will help save your life and just help with your health, make sure that you spread the word and look out for yourself, since we do know there are ways. I think a lot of people think you're just born with it, or I'm going to get it because everyone else in my family had it. But it is so good to know that there are some tweaks that you can make about yourself. Doctor, thank you so much for coming on, and thank you, of course, to Lexington Medical Center for coming on every week and informing us. So make sure you stay tuned all this month for our breast cancer awareness segments, and share this with a friend. We'll have this full interview on SodaCityLive.com. Very important information for you to tell your family and your loved ones. We're going to take a